Hello, my name is Stephanie, and today I will be performing the ophthalmic medication administration skills video. I'll start off by verifying my doctor's order, and I'll go ahead and verify that I have the right patient, drug, dose, time, route, and the proper documentation. I'll open up the EHR record here in the computer in the patient's room to verify the order. I'll take the medication and I'll verify it against the doctor's orders one more time. And today the doctor has prescribed Timolol 0.25% solution to apply 1 drop in each eye twice a day. I enter the patient's room. I close the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, Mrs. Garcia. My name is Stephanie, and I will be your nurse today. Can you please verify your first name, last name, and your date of birth? All right, thank you so much. I went ahead and verified my patient with 2 patient identifiers. So, Mrs. Garcia, before we get started, can you let me know if you have any allergies to medication, to food, or to the environment? You don't? Okay. So the doctor has ordered Timolol eye drops, and these eye drops are used to treat glaucoma and hypertension in the eye, better known as pressure in the eyes. So the goal of the medication is to decrease the pressure in the eye to make you feel better. And we're gonna go ahead and go over some of the side effects. So you may experience irritation in the eyes, dryness, and you may experience watery eyes as well. Some of our patients have experienced dizziness, lightheadedness. If you do notice any changes in your breathing or heart rate, please do let me know right away. Other patients have experienced a burning or a stinging sensation when we apply the eye drops in the eyes. You also may experience that. And other patients have experienced sensitivity to light or dizziness, a burning sensation. So if you do experience that, please do let me know. We do advise that you don't drive after the eye drops or make any serious decisions, okay? Do you have any questions before I go ahead and administer the eye drops? No? Okay. So we're gonna go ahead and perform hand hygiene. And then I'll apply clean gloves. All right, Mrs. Garcia, so I can go ahead and lay you all the way back, or I can move you to a comfortable position. Would you prefer that? All right, sounds good. So I'll go ahead and lower your bed, and then I will lower your side rails here as well. So we're gonna go ahead and start by cleaning any discharge around the eyes with a clean Kleenex. If I do see any crusts, I will go ahead and use a wet rag. So I'll start off here in the eye, from the inner canthus to the outer canthus, and then the other eye again from the inner canthus to the outer canthus. All right, and we want to make sure that we don't scrub your eyelids. So now that your eyes are nice and clean, I'll go ahead and remove my gloves. I will perform hand hygiene, and I will apply clean gloves. All right, Mrs. Garcia, so I'll go ahead and grab another clean tissue, and I'll grab your face here. You may feel a little bit of pressure, so I'll hold your lower lid. I will lower the lid to expose the conjunctival sac. I will grab the eye drops. So when I do administer, if I can have you look up, and I will hold the Doppler here 1 to 2 centimeters above the conjunctival sac, and I will instill 1 eye drop. Right, so the eye drops can have systemic effects. We're going to go ahead and grab the Kleenex, put a little bit of pressure in the nasal lacrimal duct, and we'll hold it for 30 to 60 seconds. And while I'm doing this, I want to make sure not to put any pressure to the eyeball. After the 30 to 60 seconds, I can go ahead and remove the Kleenex. So I just want to let you know, if you do blink, we may have to re-administer the eye drops. So I'm going to ask you, try not to blink or close your eye. All right, I'll throw that away. I'll get another clean tissue here and do the same thing to the other side. I will apply a little bit of pressure, pull down on the eyelid, and that's going to be in the orbital area here of the eye. Pull it down, and I will go ahead and instill an eye drop, and that's going to be 1 to 2 centimeters above the conjunctival sac. Alright, please don't close your eyes. Perfect. So we're going to put a little bit of pressure, 30 to 60 seconds, in the nasal lacrimal duct here. This is to avoid any systemic effects. Alright, so now Mrs. Garcia, you can slowly and gently close your eyes now. I'm going to go ahead and throw this away. So Mrs. Garcia, we're going to go ahead and continue on by removing the gloves here, throwing these into the proper receptacle, perform hand hygiene. So I'll go ahead and lower the bed, lift the side rails here, and there's a call light within reach. If you have any questions, you can always contact me. Do you have any questions? Alright, you don't? Sounds good. So I'll go ahead and document my procedure outside, and if you have any questions, please do let me know. And that's the end of the procedure.